Hi guys, in this video lecture we will learn what are the electrical currents used for muscle contraction, uh, a bit of physiology as well, what's the physiology behind these electrical muscle contractions, and finally the applications of the application techniques, okay, of these types of currents. So the currents that are used for muscle contraction, they are called neuromuscular electrical stimulation, NMES. Okay, so this is a common nomenclature that you'll find in the literature. So this is the use of electrical currents to produce visible muscle contractions. When NMES is used in conjunction with functional training or activity to replace lost movement or function, it's known as functional electrical stimulation, FES. Okay, so there are like several indications for using this type of neuromuscular electrical stimulation, including neurological conditions. And also, as you see here in this picture, it can be applied to healthy individuals, okay, for athletes, for example, to potentiate their, their muscle strength. What are the differences between physiological and electrical muscle contractions? So, first of all, we have to consider some aspects, okay, including the order of recruitment, the synchrony of firing, inhibition, and fatigue. The order of recruitment in physiological contractions, we know that slow twitch fibers, they are excited first, okay? So slow twitch fibers, they are type 1 fibers, okay? This type of fibers, they are red, they are resistant to fatigue, okay? So they are excited first in physiological contractions. Physiologicals are voluntary contractions, okay? And in case of electrical contractions, are involuntary contractions because the large diameter fibers, okay, so the fast twitch fibers, type 2, they are excited, recruited first, okay? The slow twitch fibers here can also be recruited if the stimulation is increased, okay? So here we have fibers type 2 that they are white, okay, anaerobic, and they fatigue very quick, okay? So in this case of electrical stimulation, there is synchronous firing, okay, depending on the frequency of the stimulation. So this means that here we have fibers that they have large diameter, they are recruited first, and then slow twitch fibers recruited afterwards. Okay, so this is synchronous. And physiological contractions is asynchronous firing. Okay, so this is asynchronous because it reduces the potential for fatigue of only one motor unit. Okay, so we have like slow twitch fibers here, and then fast twitch fibers only if the force is higher. If you want to increase the force, the intensity, then in case of physiological contractions, we have also recruitment of fast twitch fibers. And this is an important point, the fatigue also, okay? The electrical stimulation causes the muscle to fatigue rapidly, okay? From the fast twitch fibers recruitment, because this is anaerobic metabolism, okay? So in this case here, we should apply electrical currents with caution, taking into account the potential for muscle fatigue, okay? We can resolve this issue Okay, I will explain you in the parameters because there are we can adjust, for example, the duty cycle, okay, on-off time. So in a way that we cause the muscle to relax for a more period, for a longer period, in order to avoid this fatigue, okay, which is usually quicker than in a normal physiological contraction. This is another physiological aspect that, well, physiological biophysical aspect that we should consider when applying electrical currents for muscle contraction. So this is the strength duration curve. Okay, this curve is a representation of the minimum combination of current strength here, or amplitude, the current amplitude, okay, in milliamperes, and the pulse duration needed to depolarize a nerve. So this is the pulse duration, okay, here in the X. How should we interpret this graph? So we have here different types of fibers, okay, and these fibers they have different thresholds for stimulation, okay, or excitement. So in a way that when we increase when we gradually increase the current strength and the pulse duration, the first fibers to be recruited are A beta sensorial fibers. Okay, then we increase a little bit more the pulse duration. Okay, and we have the activation of motor fibers. Here, the alpha motor neuron. Okay. And then when we increase a little bit more here, the pulse duration, we have activation of pain fibers. Okay. A delta and C fibers. A delta for sharp pain, that acute pain, and C fibers for chronic pain, that pain that lasts longer. And finally, in the end of the curve, we have the firing or the activation of denervated muscles. Okay, so that muscles, for example, in considering a spinal cord injury, okay, or a traumatic injury, when the muscle loses the nerve signals, the nerve stimulation. So this muscle gets denervated because there is no stimulus that arrive to the muscle. Okay, so in case of some neurological conditions, we have these denervated muscles. And as you see here, denervated muscles, they require longer pulse durations, okay, to be activated. This is still under debate, okay? This is a bit controversial because some evidence say that this is not really very possible to activate the denervated muscles. And also considering that to activate denervated muscles, we need like very high pulse durations, okay? And this is very uncomfortable for the patient because if I want to activate this here, the denervated muscle, I have also to activate the pain fibers. So this causes discomfort for the patient. Okay, so that's why this is still like causes a bit of controversy in the evidence. So short pulse durations. This means that pulses less than 80 microseconds, as you see here. This and low current amplitudes, they are used for sensory stimulation, okay? A beta sensory stimulation here. And longer pulse durations and higher amplitudes, they are used for motor stimulation. Okay, so this is generally speaking when we adjust the parameters for these for triggering these specific nerve fibers. So when we want to stimulate motor neurons, okay, we commonly use motor points to stimulate motor neurons. What are motor points? Motor points, they are points that they are located on the skin, okay? And in this specific point, we have higher signal of action potentials in the muscles, okay? So it's necessary to identify the muscle motor points prior to set up electrodes. How can we do this? We can identify motor points using a specific pen. Okay, there is a video that I will show you in the next slides. And this video shows a pen that is used to detect motor points. So I basically we basically we have to like what's the word for that? Pause to look it up in the translator. So the word is sweep. So we basically have a pen, okay, that this pen we sweep around the muscle, okay, and this pen will detect when there is more activity of action potentials in this muscle. Normally, this area is located in the muscle belly. Okay, so we go to the muscle belly, which is like the most superficial area of the muscle on the skin. Okay, and the motor points will be located there. So the electrical stimulus will produce the greatest contraction with the least amount of electricity necessary, okay, to activate this motor point because it's superficial in the skin. Imagining if we place the electrode in an area that is far away from the motor point, okay, this means that we will need more electricity, okay, so higher intensities of electricity to activate the muscle. So this is not necessary to activate the muscle with high intensities. We can always opt to find the motor point, and there we will need less intensity of electricity. Okay. So we have these pictures here illustrate the different motor points that we can find in different areas in the lower limbs, upper limbs, okay, chest, abdomen, and back. And how to place the electrodes. The most common application is to place the electrodes around the area to be treated, okay? The electrodes should not be placed over bony prominences. Why is that? Because over bony prominences, this is not a motor point, as I just said. The motor points, they are located over the muscle belly, okay? And also considering that when we place the electrode over bony prominences, we could cause electrical burns, because it will cause a higher energy density over only one single point. Okay, so this is not desirable. Large electrodes are more comfortable for the patient. If you see here this picture, we have different types of electrodes, different sizes and different shapes as well. Okay, so the large electrodes, they are normally more comfortable because the current density here is lower. okay? So if you compare this electrode here, this rectangular, compared to this small one here, okay? So the current density in the small electrode is higher than the current density here in the large electrode. The current density here is lower, okay, in the large electrode. So that's why the large is more comfortable for the patient. And the distance between electrodes affects the depth of the current in a way that when electrodes are placed close together, okay, we have more higher current density in superficial tissues, okay? And when we place electrodes further apart, we have higher current of densities to the deep tissues, okay? And we have different types of applications, okay? We have monopolar, bipolar, and quadrupolar applications. I'll show you the picture here so we can, this can illustrate better. This is monopolar application, okay? In the monopolar application, we have the application of the small electrode. So this is small electrode and a large electrode. The small one is the active electrode, okay? So this is the negative pole, okay, or the cathode. And so this is active because, as I explained before, the size of the electrode matters because here we have higher current density in the small electrode, okay? And why do we use a large electrode? Normally, the large electrode is placed further apart from the active. Okay, so this is the active electrode, and this is called dispersive electrode. Okay, so the dispersive electrode is placed further away from the area to be treated. This is because these dispersive electrodes, this acts in a way to induce hyperpolarization. Okay, so remember the all or known law that when we have hyperpolarization, no action potential is generated, is triggered like a gun. Okay, so this the dispersive electrode causes hyperpolarization in the area. Therefore, no action potential will be triggered, okay, in this area of the dispersive electrodes. So this here is the cathode, okay? Sorry, this is the anode or positive pole. And this is the cathode or negative pole. So the monopolar application, we have the active electrode, the smaller in size, is placed over the target area, and this ensures a greater current concentration in the treatment area. Okay, so the dispersive electrode, larger in size, is placed at a distance from the target electrode to complete the circuit. This application is mainly indicated for stimulation of single motor points, or acupuncture points, or trigger points. Okay, we use monopolar application. For tissue healing, including wounds, okay, or edema, or iontophoresis. This is monopolar application, and also for electrodiagnosis of neuromuscular disorders, in which we use this kind of application. The bipolar application requires two electrodes of one channel. Okay, so we have the electrodes have the same size and the same shape. Okay, so that the current density is equal in both electrodes. Okay, and we have two electrodes in one channel. Okay, and quadrupolar, we have 4 electrodes and 2 channels. Okay, so 2 channels. We can have one machine, one machine for electrotherapy that has 2 channels. Okay, so we apply here the electrodes. So by convention, this is the negative pole, the black, and the red one is the positive pole. Okay, so negative and positive form one circuit. Negative, negative and positive form another circuit. So here we have 2 circuits, okay, and 4 electrodes. The bipolar application is mainly used for muscle activation, contraction of muscles, okay, and pain modulation. And the quadrupolar application is more suitable for large treatment areas for pain modulation. Okay, so here in case of tanks, okay, more specific in large areas, including the back, for example. And the neuromuscular electrical stimulation, which is associated with a functional activity, is called FES, functional electrical stimulation. So this stimulates muscle contraction during the activities of daily living, okay, including sitting and standing up from a chair, walking, cycling, reaching or manipulating objects. Okay, so in this picture here, you see the device applied here in the leg. This activates predominantly the tibialis anterior muscle to avoid the foot drop during the gait. Okay, this here can also be used in the forearm. This is a different device, but the function is the same. Okay, so this helps this lady to hold, okay, to manipulate an object. And in this video here, you have another example of FES used for a patient after a stroke. So this patient had a sequela of right hemiparesis, okay, in the upper limb. And FES is used here in a task of reaching objects, okay, grasping objects here, for example. So this activation here is more functional, okay, in case of FES. This is applied when we want to do functional tasks. The parameters for neuromuscular electrical stimulation. So normally the waveform that is used in this type of electrical stimulation is pulsed biphasic waveform. The pulse frequency ranges from 35 to 80 pulse per second. Okay, to stimulate the innervated muscles, a minimum pulse duration of 10 milliseconds is necessary. But again, this is not like, the evidence here is not so strong, okay, about stimulation of the innervated muscles. We have longer pulse durations recommended to stimulate larger muscles, okay, so more than 200 milliseconds. So the larger are the muscles, so more pulse duration we will adjust for these muscles. We can adjust on-off time, okay, that would be similar to the duty cycle, okay, for muscle strengthening. The off time can be reduced with repeated treatments because it's well known that muscles with repeated treatments, muscles, they get adapted to the stimulus. Okay, so this is called adaptation. So the off time can be adjusted in this case. Also considering the fatigue, okay? When we have muscle fatigue, to avoid muscle fatigue, we increase the off time in a way that the muscle has more time to relax between the contractions. And we have also this parameter, which is called ramp time, that allows a gradual increase and decrease of force, of intensity, okay, of current. This is important because this causes the current to be more comfortable for the patient in a way that it gradually increases and decreases. It's not like increased abruptly, in a way to be uncomfortable, okay? The main indications we have are orthopedic conditions that result in muscle atrophy after long periods of immobilization, or cast immobilization, for example. We have neurologic disorders such as spinal cord injury, stroke, traumatic brain injury, and cerebral palsy. Okay, so this can help individuals during the gait, training gait, for example, okay, or during standing up from a wheelchair, okay, or a platform. It can be used in sports medicine to increase the athletic performance. So even in healthy subjects, it could be applied. Okay. Other fields such as urology as well, it has been demonstrated effective to treat urinary incontinence, because it can strengthen the pelvic floor muscles also. This is an example of Compex. Okay, this is a brand, the Compex. Compex is electrical stimulation that we don't have cables here. Okay, this is wireless. So this device is wireless, and this is a quadripolar application to the quadriceps. Okay, and this is a video recorded by my cousin. He's a physiotherapist as well, and he works with athletes. And then he recorded especially for me this video. And we can see the application of Compex associated with open chain resisted leg extension with elastic bands. So let's see how it is. So as you see here, there is activation of the quadriceps muscle fibers, and the athlete also combines the electrical stimulation with resistance movements of leg extension, okay? So this can even potentiate the athletic performance. And in this video here, in this link that I put here, you can watch the demonstration of the machine of Compex Wireless Pro. So this is a video from the manufacturer. And you can also see in this link the explanation of the pen that is used to identify motor points when we use neuromuscular electrical stimulation. And finally, the electromyographic biofeedback. This is a clinical technique that records the electrical activity generated in a muscle for diagnostic purposes. Okay, and when we listen about only biofeedback, okay, this biofeedback, only biofeedback, is an instrument which gives the patient visual and or auditory feedback according to the neuromuscular electrical activity. Okay, so we basically have a device that measures the electrical activity in the muscle, okay? And according to this activity is displayed on a screen, okay? And according to this activity, this of the muscle displayed on the screen, the patient can do other activities, okay? Based on this feedback that is given. It's giving like a visual feedback in a graph, okay? Now your muscle is being contracted, and then you have an increase in the muscle activity. So this is a visual feedback for the patient, okay? Or it could also produce a sound. When the muscle is activated, it emits a sound, which is an auditory feedback to execute different tasks, okay? The biofeedback can also be applied, combined with face, okay, if you want to do functional tasks, okay. And this has an advantage that the patient develops greater voluntary control in the process of muscle reeducation, okay. So this is nice and more interactive as well. So this is interactive, this is playful for the patient. You have here an example of virtual reality rehabilitation, okay, which is also, this is not considered electrotherapy because no electrical current is delivered to the patient, okay. So in this case, in the biofeedback or virtual reality, the patient doesn't get delivery of electrical currents, okay? Instead, the device will measure the muscle activity, and this will generate a visual feedback to execute different tasks, okay? And in this video here of virtual reality, you can see a patient who suffered a stroke. He can play football, okay, using a game of virtual reality. So it's nice, it's playful and enjoyable as well. So that's it for now. Thanks for watching and see you soon.